The benefits of involving patients in determining their treatment. I'm Adrian Hardy, a lay representative on the BNMS Council and Professional Standards Committee, and I've no declarations of interest to make in association with this talk. I've been involved in health in many ways. At my age is not surprising. I've been a patient, most recently for a hip hop and for some continuing glaucoma treatment. But many years ago I was involved in the creation of Health Watch in my local area. I've done surveys of patients at the Foundation Trust, both on the wards and in outpatients departments. That led to me joining the Health Quality Improvement Partnership Service User Network, of which I'm currently chair. And that itself led on to the Royal College of Physicians Patient and Carer Network, of which I was a member for about 6 years. That enabled me to get taken on as a lay rep on the specialty advisory committees for both dermatology and nuclear medicine. And strangely enough, that last association gave me an opportunity to join the BNMS and on their council and their professional standards committee, which is where I am today. I suppose the question really is, why shouldn't patients be included in determining their treatment? If you go back to 2004, you get Raymond Tallis saying, well, if you actually involve them, it takes time, it takes effort, you confuse and you frighten them, and they won't get their treatment as quickly as might be anticipated. So really, it's quite a negative thing to do. However, things seem to have moved on now. Here we are with the guidance for medical students issued by the GMC in May 2016, which stresses that doctors must work in partnership with patients, and good communication is vital if they're going to do it successfully. And really, that's up to you as the doctors to do that, or you as the health workers. You can't expect the patients to always take the positive and the proactive attitude towards asking questions. This has been reinforced by the new nuclear medicine curriculum, which comes into effect in August this year. And one of the competences in practice that's required of all doctors is that you communicate clearly with patients and carers, and that you share decision making with them by keeping them informed, looking at their wishes and seeing if you can prioritise them, and respecting their beliefs, concerns and expectations. And as if that wasn't enough, every 5 years when revalidation rears its ugly head, you are expected to be able to give some patient feedback survey work that indicates how successful you are still being in involving the patients in your day-to-day activity with them. It's always good to remember this, isn't it? That patients aren't just a collection of symptoms waiting to be dealt with, but they're human beings there. They've got concerns, they've got beliefs, they've got anxieties, their past experience, everything will have an impact on how the treatment they're expecting will turn out and what they're prepared to undergo. Allied to this, of course, is their family background and the levels of home support they might have afterwards, which will itself have an impact on the nature of the treatment that you can suggest and the speed at which they can exit from the hospital into some recuperative care. So, what are the benefits of greater patient involvement? Well, firstly, patients can have a choice of medication that suits their lifestyle as well as their condition. And if you do this, it might avoid the need to prescribe additional medicines that counteract the effects of the ones you've given them already. Patients understand why their investigations are going to take place. If they know that, they're more likely to attend and then participate in future discussions about their care and their care pathway. And I think it's important to remember and emphasize to people, particularly in nuclear medicine, just how expensive these investigations can in fact be. And time constrained, of course. There's also the potential reduction in unused medicines and the overuse of antibiotics, which can arise if you just sit and talk to people about what can be provided and what's efficacious and what really makes them feel better in mind, but not necessarily going to have an impact on their body. And of course, you can reduce their anxiety about the nature of the investigations that are going to be taking place. Many of us now are used to having x-rays. Some of us get used to colonoscopies and endoscopies and things like that, which require you to perhaps fast for a few days in some cases. But there are other investigations, perhaps with nuclear medicine radioisotopes, that people aren't sure what the limitations on their life might be afterwards. And that's where it's important for you to be able to explain to them what the limitations might be, but also what the benefits are going to be. So what are their anxieties? Well, from the work I did in the past, talking or surveying some nuclear medicine patients, they seem to be more worried about what's going to happen at the end, what knowledge is going to emerge from the investigations, what will the scans show. Is the illness as bad as anticipated? Is it worse? Is it needing more urgent treatment than possible? And how quickly can they get that treatment? When I first got into this area of activity, I thought they might be worried about the nuclear aspect of this. But in reality, it seems to be more that this is one of the investigative procedures that's taking place, and they want to get the answer out. So perhaps the important thing to remember here is speed of getting the results back to their clinicians, so that you can join with them, if appropriate, in a medical debate as to what their best courses of treatment might be. Of course, even doctors make reluctant questioners. Here's a couple of comments from people who you might have thought had a bit more about them. Henry Marsh, the brain surgeon, when he had to go in for an operation, he was getting a bit worried about the surgeon who was going to operate on him. And Rachel Clark, when she was in the maternity ward as an inpatient, even though she was being trained as a doctor, she just felt totally anonymous. She was just a series of activities on the bed which needed to be dealt with, rather than someone who actually could participate in the discussion and decisions about her treatment. So, how can you address these issues? Well, I think firstly, and most importantly, and most difficult in many circumstances, will be to find the time to talk to the patient and their family, and listen to what they actually say to you. Often when you ask people questions, you're listening out for the answer you expect rather than the one that they give you. And what is important is listening to what they actually say to you and then acting on what they have actually said. Secondly, and quite difficult in a hospital situation, particularly if you're on a ward, is finding a time and a place where you can be private and uninterrupted in talking to the patients themselves. This appears to be one area where palliative care nursing comes into its own, because these nurses, not being on the general ward all the time, do have time to sit and talk to patients and talk to them about their family worries, their finance worries, their job worries, as well as their underlying health issues and what their course of treatment might be and the impact that's going to have on them. Also, if you can provide information in advance of the interventions so they know what's happening and why it's happening, they're more likely to feel relaxed about the procedures which are taking place. And of course, delays do occur. Sometimes the isotopes can't be ready on time, the previous patient is taking longer, and now with COVID impact on lockdowns and the delay in actual treatments taking place, it's even more important to keep in touch with patients to explain to them they're not forgotten, they will be called in due course, and you're doing your best to get them there as soon as possible. It's not just the doctors in a department who can support patients, though, is it? There's things that could be done. Could the department open for longer hours? Could it open at weekends occasionally, so that patients who need family support to get to the hospital can get there more readily and easily, and even more cheaply if they can actually get use of their bus passes and things like that, rather than taking taxis at peak hour and using their pension money on that. Quite often patients travel long distances, particularly to nuclear medicine facilities. Can their appointment times be put later in the morning? And if not, explain why, because the investigation is going to take most of the day, they need to come early, or the shelf life of the isotopes are such that they need to come promptly in order to make sure they can get the results out at the end of that day itself. After COVID has happened, how about facilities for those who attend with the patients to be made more comfortable while they wait? So many patients do indicate that they are accompanied to their appointments, so the person who's waiting does need also some care and consideration. And I suppose most of all, make sure you encourage them to ask questions. You can send them information in advance, and many nuclear medicine departments have comprehensive websites and documents they do send out. But when you're ringing them up or when they're calling on you, encourage them to ask questions. repeat them. Have you got anything else you need to know? What else can we do to help you? That sort of thing makes all the difference to the patients. Now then, you might say, does talking to patients work? Does it have any impact whatsoever? Well, Dr. Rachel Remen, in her book, which I cite here, Kitchen Table Wisdom, she was ill with many illnesses over her lifetime, and she carried on working until one day she went to see a doctor who said, I'm surprised you're still practicing medicine. And she thought, well, perhaps he's right, perhaps I ought not to be. Until a friend noticed that she was really gone down in the dumps and said, what's wrong with you? And she explained, said, well, God, Rachel, you're a warrior. And then she thought, well, he's right. I believe in myself. I'm going to get on and do this. And if you can think this could be the time and impact of talking to patients who are doctors, how much more valuable is it to spend time talking to patients and increasing their level of knowledge of their condition and potential treatments when they're not doctors, when it's all new to them, when you can assuage their anxieties that they've learned from the web or talking to people who might have had an adverse experience. All these things are important and actually do help the patients perhaps respond more positively. And Ben Goldacre, in his work Bad Science, talks about the placebo effect and is that a good medicine treatment? And he noted that whilst placebos themselves are having no impact on your body, the fact that people are sat and talked to by doctors and people pay attention to them improves their psychological response to the medicines they think they're having or to their illness. And really, he's saying, if chatting to people and talking to them when they're given placebos can have an impact on their sort of responses, how much more impact is it going to have when they've actually got some effective medicines inside them, and you can then talk to them and encourage them to think in a positive way about the things that are going to change for them. And if you're talking just to them about medication, then there can be a resistance when other options are tabled that require them to play a more active role. You've seen it recently when people are suggesting that activity rather than medicine's a way of overcoming depression. Don't keep taking the tablets, go out and get some walking done, go out and take up a new hobby. Things like that are important. But as Anya DeLong says, if you don't talk to them about the options, they're not going to know they're there, and they're going to feel that the only thing that can be helping them is an operation or a pill. So as doctors, as clinicians, it's important to actually explain a range of activities all the time, rather than just think, give them a pill and that's the end of it, see them out the surgery and off they go, not to be seen again. Whilst I have talked to patients, it's quite clear that on the wards, patients do feel constrained about talking to doctors. The visits of the doctors or the consultants are fleeting, they're not private enough. The percentage expressing satisfaction with being kept informed went to 95% in 2016, but it's back down to 80% in 2019. And even the staff admitted that only 90% satisfaction with how they kept the patients informed. And the Nuffield Trust itself says that really when they've surveyed it, only half of adult inpatients and 60% of GP patients feel they are getting the involvement they would like in determining their healthcare. So if they don't feel talked to, you have to accept that more effort needs to be made. So what is really the impact of my little talk is to remind you all, I know you know this, and I'm just really trying to reinforce it, that when everyone puts a twopennyworth into the pot to make the patient know what's going on, the doctors, the clinicians, the carers and others, they all got part of the big picture, which once they've got it to the patient, enables the patient to actually have a more positive response to the treatment they're being given. So, lessons learned. Talking to patients can lead to better health outcomes for them. It leads to less waste of resources, time, equipment and medicine for you. But it needs you to initiate and encourage that conversation. Don't rely on the patient asking you. You find the time to let them ask you, encourage them, ask them open-ended questions, and then listen to what they say to you and do and act upon what they are asking you to do or say to you. And finally, of course, use that feedback from them so that next time you meet a patient, you can be even more effective than you've been in the past. Thank you for listening, and I hope this has just raised a couple of points in your mind which will help you deal with your next patient just that much more effectively.